Hello and welcome to StratNews Global. I'm Nitin Gokhale. StratNews Global, as all of you know, is an Indian digital platform looking at international relations and strategic issues from an Indian perspective, but looking at South Asia and beyond. And today I'm privileged to host second in the series of webinars that we have planned on COVID-19, the pandemic that is affecting not just India or the South Asian region, but across the globe, its effects are being felt. And I'm honored to host two very distinguished guests on my show today. First, former Prime Minister, three-time Prime Minister of New Zealand, Ms. Helen Clark, also past administrator of UNDP, and from Mauritius, the past president of Mauritius and biodiversity scientist, Ameenah Gurib-Fakim, who's joining us from Mauritius. So in this times of pandemic, we are on video conference, but that's the way I think going to be the way forward as we see it. So welcome both of you to this program. And let me start with Ms. Clark first. Ma'am, you've spoken in the past to our channel and you've said, and I'm going to ask you again, do you think in this time of crisis, the global leadership has actually not measured up to meeting the challenge of this pandemic, especially the UN Security Council? Can you tell us what's your view on that?
It's my view that there's been a big vacuum in global leadership. Dr. Tedros, the Director General of WHO, I personally think has been doing an outstanding job. Let's face it, 4 months ago, he and the WHO and none of the rest of us had heard of this new virus. But once it was notified to them, 31 December, they got cracking. They declared it as a public health emergency of international concern by the end of January, and the rest is history. But unfortunately, most others didn't step up alongside Dr. Tedros and the WHO. Think, for example, 2014, the UN Security Council declared Ebola to be a threat to peace and security and urged all member states to step up to do whatever they could. We have had no such resolution on this, notwithstanding that this pandemic is sweeping the world and now threatening the least developed and low-income countries. So that's a huge leadership gap. Secondly, I was part of an appeal with many other former leaders to the G20 leaders to step up, and particularly to be supporting the World Bank and the International Monetary Fund and the regional development banks to underpin the health response and the economies and societies of poorer countries faced with huge issues. Now, to some extent, our appeal has borne some fruit, because there were some quite good announcements out of the spring meetings of the World Bank and the IMF last week, and G20 finance ministers meeting, but not yet at the scale required. If you look at the op-ed from Prime Minister Gordon Brown and Larry Summers, former US Treasury Secretary, you will see that really we're talking about the need for a $2 trillion package, and at the moment we're seeing more the petty cash than that. So I really urge the G20 leaders to keep stepping up and supporting the international financial institutions to do their job. Look, debt waivers, absolutely critical, and not only for just the most fragile countries. You think of the Caribbean, the Indian Island Oceans, which survive on tourism, the Pacific. Their economies are devastated by the fact that no one's travelling, and no one much is going to travel for quite some time to come. So even what can be quite high middle income countries need support with debt relief right now.
That's right, ma'am. But before I come to you, Ms. Fakim, I'll just want to ask you what explains this failure on part of the global leadership in Security Council, especially UN Security Council. Can you put a finger to it?
I think we're in a perfect storm, and in the perfect storm, there's been particularly toxic relationships at the UN Security Council. So the first attempts to get a resolution led to a blame game with one pretty obvious country wanting to call it the Wuhan virus. Well, clearly another pretty obvious country isn't going to agree to that. So you go around in circles. Secondly, the G7 leaders would normally be counted on to step up with the international response. They're currently chaired by President Trump, so I need say no more. But also all of the G7 are struggling with raging epidemics. And then you come to the G20, which currently is chaired by Saudi Arabia, which, in all honesty, is not the strongest chair to have at this time. So the perfect storm has seen this vacuum emerge. As I say, I'm quietly positive about what came from the International Financial Institutions meeting last week, but I'm still waiting for the Security Council to move, as most of the General Assembly would like it to do. The General Assembly passed a good resolution, but it doesn't have binding force. The Security Council's resolutions do have binding force.
Quite right. Ms. Ameenah, you are in a country which, of course, depends on a lot on tourism. It's an island country. What do you agree with what the former Prime Minister of New Zealand is saying, that the global leadership has not really stepped up to the challenge?
Again, thank you, Nitin, for having me on this show. I totally agree with what Ms. Clark has said. Leaders or great leaders have revealed themselves to the world in real times, I think, in the course of this pandemic. And as it had been mentioned, there has been a tendency for blame game. And initially, I think there was a lot of a call to call it the Wuhan virus as opposed to the COVID. Now it has moved from SARS-CoV-2. So this blame game has started. And then, as I said, is that it was perceived to be a Chinese virus. So China was expected to solve its own problem until it has started spreading all over the world. Now, in terms of the leadership, I think at this moment we have seen great leaders emerging. They are those that have acted with urgency at national level. They are those that have communicated with transparency, and we have seen how good communication has been very useful in getting the people to rally around the cause, and communicating regularly, providing honest and accurate description of the reality, and also to be acting as humanely as possible. So these are things, the messaging has been very important. Of course, I'm talking about local level, but I think we all agree with Helen that at the level of the international community, we're still waiting for that global leadership to come through. And at national level, those countries that have done so well, which are coming out of it, we have seen, for example, progress in Singapore, we have seen progress in South Korea. And these are leaders who have responded productively to missteps. And they have been on the defensive, they have not gone into blame game, and they have stayed focused on the goal and the way to go ahead. And also what we have seen, and I go back again to New Zealand, we've seen what Jacinda Ardern has done, is that she has engaged in constant updating. And this is so important for people to know. And this means they have relied on expert opinion. They haven't gone into the political narrative. They have gone to the expert to provide the diverse opinion. And finding and leveraging the right people, I think, for evolving problems is also very, very part of updating on the challenge. And one thing that I have also appreciated with New Zealand leadership is that Jacinda has not tapped, or rather she has tapped into the suffering to build a meaning. And this is so, so important. And the leadership is strengthened continually, referring to the big picture as an anchor for meaning and for resting the temptation to compartmentalize or to consider human life purely on statistic terms. As so leadership in an uncertain, fast-moving crisis means making oneself available and also to lead with empathy. And this is what we expect at the international community. Credibility, go back to the sciences, go back to the facts, and also lead with empathy. And I think, unfortunately, Nitin, we find that women are showing the way forward.
I think I was just coming to that, Ms. Clark. In fact, if you look around the globe, it's the women leaders, Germany, Finland, Iceland, New Zealand, who have really done well. And very fair point, Ameenah, on this. Do you think women are more better listeners, and they're better at coordinating multiple inputs and being empathetic to the sufferings of the people. You think that's one of the reasons why these women leaders have done better than their male counterparts, Ms. Clark?
I think it's true that on average the women leaders have done better. I don't want to, of course, dismiss some of the very good efforts from male leaders. And I think, for example, the President of Korea has done very well, the Prime Minister of Singapore. There are others that one can also name. But for the women, and again, I'll say in general, because it's not every woman leader everywhere, I think the women bring a greater quality of empathy with human feeling to these kinds of decisions. And certainly sitting where I sit in Auckland, New Zealand, and watching our Prime Minister, Jacinda Ardern, communicate, I see that. Now, of course, the number of things have to come together for a leader to shine. Jacinda Ardern is a very good communicator. B, she has very good advice. We have an incredible Director General of Health who's a public health person from way back. And he has surrounded himself with the range of expertise that you need across microbiology, immunology, epidemiology to make the right decisions and get the systems to respond. Thirdly, we have very, very good community engagement. And that is in the feedback loop from the Prime Minister herself, fronting the media briefings 5 days out of every 7 every week. And the Director General of Health also. At a weekend, someone at a lower rank will come and do it. But they are constantly communicating. You can never communicate enough if you want to bring your communities with you. And perhaps this is also a characteristic of the other women leaders. The fourth thing I would say about New Zealand, and the same could be said about Mauritius, is it is, in a pandemic like this, an advantage to be on an island because you can effectively close your border. Mauritius is a remote island. New Zealand is a set of remote islands. But you still have to make your luck. You still have to take the right decisions. And our decisions here in New Zealand have been to go hard and early with the measures that we take. And we're now in the fortunate position, as was announced today, of being able to step down a level from the very high level of alert that we had. We are on a path to elimination of the virus here, but we can't sit happy until we see the world on top of it.
Well said, Ms. Clark. Ameenah, if I can come back to you now, let me move a little bit to the post-COVID-19 situation. What should the world do? I mean, one, of course, some of these are given that the health infrastructure needs more investment, perhaps more attention from governments all over the world, and especially for countries like India, which are vast, big population. They need to, I think, reorient their policies in that. What would be your advice to the world in general, but to underdeveloped countries in particular?
Again, I speak on behalf of Mauritius. We have invested a fair bit in our health system ever since we've been independent. But I think globally, and I think for the African continent and elsewhere in the developing world, this crisis has exposed an endemic lack of resilience and symbolized by chronically under-resourced healthcare. And of course, even in countries which are well off, we have seen that the lack of preparedness has just been amazing. And so what government have to do is use all the resources that they have to address this. And we have even seen in some countries the paramilitary, for example, coming out to distribute food so as to prevent a social crisis or attack or things like that. So this is what we need to do, is forever be prepared, because in the wake of climate change, as we shall see once we get out of COVID, we will see other pandemics coming up. So this calls for preparedness, and preparedness, Nathan, is not only in terms of infrastructure, it's also in terms of the human capital. We don't invest enough in the ecosystem for our people to stay behind. And because we don't invest in the ecosystem, we suffer the endemic brain drain. And this is something that we can no longer afford to have, especially if we are going to be, first of all, come out of this crisis and rebuild the economies, as we have just heard Islands like Mauritius and New Zealand, we depend a lot on tourism. For Mauritius, we have almost, 9 points directly into the economy coming from tourism. But if you look at the aggregate sectors, they push it up to about 23%. So from now till December, we have cut off this very vital revenue which would come from the tourism sector. So whatever be the economy of any country, please invest in our people, invest in the human capital, invest in the ecosystem, invest in the healthcare infrastructure, because otherwise we will be forever having this conversation again and again.
Would you agree, Helen? Human resource is the most precious investment that governments all over the world can do, especially on training paramedics and, of course, health professionals, and, of course, public health infrastructure.
Most definitely. And I think it's the public health infrastructure that we really need to focus on. You know, if you have medical insurance in America, you will get access to the best hospital infrastructure in the world. But what you see, and some of us didn't need to see this distressing saga play out, is that you cannot hospitalize your way out of an epidemic. You have to be on the front foot to contain and move against the virus, to get ahead of a virus. And that requires a public health infrastructure. It requires those points of contact with the community, the ability to trace contacts, the ability to test, as Dr. Tedros at WHO keeps telling us, to isolate people who may have been in contact, to quarantine those who are ill. It's very, very basic infrastructure. And sometimes we see in least developed countries some not so great decisions on health spending, which haven't started with those basics. I can think of one country where a quite sophisticated hospital put in takes up not far short of half the national health budget. Well, there's not much left for these basics. So back to basics. When the vaccine comes, it needs to be rolled out. Just as we roll out immunization against measles and the basic childhood diseases, against TB, against polio, so that would be my plea, to not think that a very sophisticated hospital system is going to get you through this. It won't. It's population health that really matters in a pandemic like this.
That's true. In fact, the G20 health ministers had a conference, a video conference just 2 days ago. Hopefully, they are seized of this matter, and the way forward, the strategy that they must adopt to get people out of the current pandemic raging across the globe. But in the long term, Helen, you think the WHO also needs to now reorient some of its policies and maybe get more help from the countries rather than being demonized as it has happened in the past couple of weeks or more. Is that the way forward? I'll come back to you, Ameenah.
So as the former president of Mauritius said, we're all stunned at how this pandemic has seen the greatest economies on earth struggle to deal with it. All of the G7 economies struggling to deal with it. So we wait with our hands in our mouth to see what will happen if this pandemic gets traction in the poorest countries. And that's why I will keep appealing for globally coordinated action at scale, for the debt waivers, because countries now, and some of them spend very significant amounts of their budgets on debt servicing, they need to repurpose that money into this basic population health response that I am talking about. Secondly, if you're going to lock down, you need to offer your people some social protection, even if that social protection is a meal, 2 meals every day, because I've been really touched by the distressing words of people from poor communities around the world who are saying, I'm going to die of hunger now before I die of COVID-19. And I can understand why they say that, but that shouldn't be the choice that they're being given. They need food. People need to put food on the table for their families. So social protection costs, that's why this international response has to come in behind the poorest countries to do that. And then if you're an economy that has just come to a standstill, as many have, and you're not going to get much tax revenue this year, people are not at work generating income, you need to be underwritten. The letter I supported with Gordon Brown to G20 talked about a need for $500 to $600 million of special drawing rights, and that's before we even start on other support packages. So we need a comprehensive health, economic, social approach to this crisis. And, I feel very fortunate to live in a country like New Zealand where we have that approach. We have deep pockets. We can subsidise the wages of 1 million people. We're only a country of 5 million, so you can imagine what a proportion of the workforce that is. We can provide compensation for our businesses. We wouldn't want it to go on too long, but we can hold the line while we move to elimination, and we will be stronger in our economy for having a good health response rather than a bungled health response. And we are seeing quite a lot of bungled health responses around the world right now.
True, but that choice, Ameenah, is not available to many other countries, what New Zealand is doing or will be doing. So in that case, do you think multilateralism is the way forward, although a lot of obituaries have been written about multilateralism in the past couple of years because of inward-looking leaderships and nationalism rising all over the globe. Do you think we are going to be, cooperate with each other more, all countries, big and small?
Definitely, I think there has been a lot of nativistic way of looking at the approach in many countries, and I think we should be looking at the COVID differently, where there is a call precisely for multilateralism. There's a call for more sharing. And I think, as Helen has said, but I think it will come also from the country itself, how the countries are providing a social safety net. And those countries that have a good taxation system, for example, and I think of some Scandinavian countries where you pay a lot of tax, but where you have a quality of healthcare, you have a quality of education. I think there we are seeing they're leading by example. So definitely there will be a call for a multilateral approach. We will need, poorer countries will need that support as well. And as Helen has said, how do we actually bring about debt relief for those poorer countries? I think IMF has already started. I've seen at least 20 countries are getting some debt relief. So hopefully through proper governance with these countries, they will be able to redistribute. So, all these are calling for a post-COVID-19 world where hopefully we'll see more sharing, we'll see more investment, as I said, in that public space, and where we'll see government back, because we can no longer go around with the same approach that, moving from the stakeholders to a very shareholders approach we have seen so far. So we need government back, we'll need regulatory bodies, we'll need a rethink of the way we have been doing things. So at the end of the day, maybe the COVID may have served some purpose if it is to rechannel the way we have been looking at things.
Great to know that. And on that note, let me thank both of you for your time. We have run completely out of time. We don't want to take much of your time because both of you are busy ladies. But thank you very much for joining this conversation. And hopefully the world will come out of this pandemic stronger and better as we go along. Thanks very much. And to our viewers, don't forget to like us on our various social media platforms, and of course keep sending the feedback. We'll come back with another edition of this webinar in due time. Thank you very much.
Thank you, Nitin.
Thank you.
Thank you.
Pleasure.